Hello. Hello, everyone. Mic test. Mic test 1, 2, 3. Okay, I think. Yeah. Hello, everyone. Who's here? I'm Mac. Hello. Louis, Milia, Lemon Croissant. Hello, Zanze. Panarax. Hello, Paimon. Kiorazin. Hello, hello. Ventix. Hello, Orion. Hello. Midas. Hello, Kenmoto. Hello, hello. Tim. Hello, hello. Hello, everyone. Welcome to my stream. Welcome to this month's final stream. Final stream of the month, which is a medical education stream, and here on YouTube. Hello, good evening, everyone. Yeah, good evening, good evening. Okay, so tonight I'm gonna be talking about trauma. Not emotional trauma, okay? This is physical physical trauma. Wait, hold on. What the heck? Hold on. This is physical trauma, okay? Like, you know, physical trauma including vehicular accidents, gunshot wounds, stab wounds and all that, blunt trauma, head trauma and all that stuff, Okay, nothing nothing emotional or mental. Hello, Henry. Hello, hello. Chips, hello. Yeah, I'm sorry if you hear chirping in the background. That's my cockatiel, my bird's with me right now, and she's just chirping. So you're gonna be hearing chirping while I'm doing the stream. Yeah, it's a PGI present. Oh, hello, Ryan. Hello, hello. Yeah, don't mind the chirping in the background. That's my cockatiel, my pet bird. I have a pet bird. she's she's just I don't know. She's just chirping around in her cage. Anyway, yeah. So this is a little different from my usual. This is more interactive, okay, than my other lectures, because when it comes to traumatic cases like this, it's more of a judgment call rather than, you know, something you learn out of a lecture. I mean, there's some guidelines in lectures, but then when you're managing trauma cases, it's more of judgment call. Yeah. Bird ni Doc maingay. Yeah, leave my bird be, Silas. Let my bird be noisy for all she wants. Okay, she's just chirping, and at least she's not screaming. Sometimes she just screams, like all birds. Birds scream. Okay. All right. So, this will be more of, like I said, interactive. How this is gonna go through is like how they do it with us when I was in my clinicals, when I was in medical school, or like as an intern. What they do is they give us cases and then they ask us what we're gonna do. Let her burp be free, bruh. Hello, wizard. Is burp kawaii? Yes, my bird is very kawaii. Why do you guys want to hear my bird screaming? You'll hear her if she starts screaming. It'll just be like loud chirps, like really loud chirps. Yeah, birds can scream. They scream a lot, actually. They're very noisy. Anyway, yeah, that's aside the topic. Anyway, yeah. So let me okay. Let's turn off. Oh. I'm gonna use a laser pointer for now. Yeah, laser pointer. See this? Okay. Alright. We're gonna proceed now with our lecture, okay? So, today is trauma. Physical trauma. Alright, first up, we'll deal with chest trauma, okay? So, trauma to the chest. I'm gonna give you guys a case. Like, the patient is whatever year old, or whatever, you know, the patient. They usually give names, but this time there's no name. I'll just say like the patient is a blank, is the age, and I'll give you the situation, how the trauma came to be, and I'll just give you a little background of how the trauma went by. And I'll give you the physical examination. And then I'm gonna ask you guys, what would you do if you receive a patient like this? Alright? Okay, that's how it's gonna go. That's how it's gonna go. This is gonna be interactive because trauma is more judgment call. Like I said, this is more judgment call rather than a lecture. Okay? So think of this as your exam. This is like exam within a lecture. Or exam within a PowerPoint. I'm gonna be grading all of you. I'm gonna grade all of you. Okay, we'll go to the next slide, okay? It's a case now. Okay? Alright, first patient. We have a 1-day-old Bred. Okay? We have a 1-day-old Bred saying he can't breathe. He can't breathe. So the nature of the incident is mauling, okay? He got mauled. He got mauled a while ago at 6:30 p.m. Today, date of incident, February 28th. Alright? And the place where he got mauled is some bakery in Tondo. Okay, that's what happened. Okay, that's the story. So you can see his physical examination. Okay, I'll explain the physical examination for you guys. BP is blood pressure, okay? Vital signs. BP is blood pressure. So we have 80/50 blood pressure. That means it's low because the normal blood pressure is 120/80. And then we have his heart rate at 115. Alright, normal heart rate is 60 to 100 beats per minute. So his is elevated, it's high. Respiratory rate, or RR, is 28. The normal respiratory rate is up to 20. Okay? Normal is up to 20. So he's breathing pretty fast. His temperature is 37. This is within normal, okay? Temperature, the fever. When you have fever, the temperature should be like 37.8. That's the threshold. All right. Now he has a 7x6 centimeter soft tissue contusion on his left chest. So that's right here. This one right here is the soft tissue contusion. And he has a 6x5 centimeter abrasion on the left chest. And when I use my stethoscope, which is the blue thing around my neck, when you look at my model, and I listen to his chest, he has decreased breath sounds. That means it's not as clear on the left than it is on the right. Okay? Because what? He got hit in the chest. Okay? Alright, so you guys get the info? You guys got the info? Tayo na ba ito, Hunter? That is not Hunter rank! That is not Hunter rank! Bruh. Okay, so I'm gonna sum it up. I'll summarize it again, okay? He got mauled. He got beaten. When you say mauling, he got beaten up in some bakery in Tondo at 6:30 p.m. a while ago. He comes to the ER saying he can't breathe, and when you look at him, he has low blood pressure, high heart rate, high respiratory rate. His temperature is within normal, and his O2 sat. Actually, I forgot about this. O2 sat, his oxygen saturation is low. It's 87 because the normal is 95 and above. And then he has contusions on his chest and an abrasion. Okay? You got it, guys. You got it. We're gonna go to the next slide. So what are you guys gonna do? What are you gonna do to the poor one-day-old Brad with an injury on his chest? I'm gonna look at the comments. What are you guys gonna do to him? Low blood pressure. Ang abusive naman ng baker. What would you guys do? What would you guys do? This is your quiz. This is your quiz. Talented ng baker. Binigyan ng dugo yung bread. Put it back in the oven. Gantian pagkabu. You guys are big. Hoy, grabe kayo. You guys are... Nabugbog na nga yung bread. You guys are beating bread up. Maul him more. What the heck, you guys? How you guys gonna be doctors this way? Re-resbahan yung nagmol. Okay. Call an ambulance. No, he's already at the ER though. He's already at the ER. Well, let's say if you saw him in the middle of the road, like lying down there with that, then you would call an ambulance. Just make sure that he's still breathing. Take out the mauled chest part. Okay, I'll tell you guys. Okay, next slide. Next slide. Okay, guys, next slide. Okay, you know that he has I'll go back to the previous slide, okay? You know that bread has unstable vital signs, okay? Low blood pressure, high heart rate, high respiratory rate, very low oxygen. Okay, this is very low. Very low because an oxygen, like I said, is supposed to be 95 to 99. No, 95 to 100%. Okay, when we see patients like this and he's complaining that he can't breathe, and you see a patient like this with a chest trauma, blunt chest, this is a blunt chest trauma, by the way, okay? And with vital signs like this, that means you have to do something immediate. Alright, you already know he has decreased breath sounds in the left chest. Aside from this, that means he most probably has bleeding inside the left chest where the lungs are, because he's complaining that he can't breathe properly, or he can't breathe. You don't do a CPR. He's still alive. You don't do a CPR. He's still breathing but having a hard time because you have a respiratory rate here. Okay, so what do? Immediate surgical intervention. We do what we call a closed tube thoracostomy. Alright? Which is basically you put a tube on the chest where the lung is. Here. I think I've demonstrated this before. Closed tube thoracostomy. You make a small incision on the chest and then like under the rib or in between the ribs. And then you have to put a tube in, and then you connect the tube to a bottle. So in Bread's case, he most likely has what we call a hemothorax, or blood in the left chest that is not supposed to be there. So you have to evacuate the blood, which is why you put a tube. Okay? Is this like the first episode of The Good Doctor? Yes, it is. Yes, if you watch The Good Doctor, in the first episode, he had a case where what's this? The patient, like something fell on the patient. The one I watched was a Japanese version, so something fell on the patient and he couldn't breathe, and he had I don't remember if it was air or blood in the lungs, but you had to put a tube. He had to put a tube. Okay. Yeah, the patient's awake. This is done while the patient's awake. You put local anesthesia. It's an injection, and then you do that. You can do this while the patient's awake. This takes like 10 minutes long to do, actually. Okay, yeah, the airport episode. I think in the Korean, or I don't know, it's in the airport. I don't remember in the Japanese one. The one I watched was Japanese. What I watched is Japanese, but what was done is the same. He had to put a tube in the chest. It's the same case, basically. They just presented it differently. Alright. Wouldn't it cause a decompression? What do you mean by wouldn't it cause a decompression? You're supposed to decompress it, actually. The lung is supposed to expand, so you have to drain the blood that is in there. Okay? Yeah, it's done while the patient's awake. Well, if it's an emergency, you have to do it while the patient's awake. He has to feel the pain, or else he's gonna die. Okay? Okay. So, once you do that, you address the immediate problem. He should be able to breathe more properly now. And after that, you stabilize the patient, and then if there are further, labs or diagnostics that need to be done, you can do it after you put the chest tube in, or the tube in. Alright? So what you have is a happy bread with a tube in his chest, okay? Alright? Okay. You guys have any questions? That one is actually an example of blunt chest trauma. It's just an example also, because when you have a blunt chest trauma, a lot of things can go on in the chest. Like in this case, I put blood, it's a blood accumulation in the chest, but in other cases, it can be air. So basically, we take the blood and those patients look their blood going out through. Yeah, that's what happens. Jason, thank you for the sub. Okay. Can we put the blood from the thorax back into the... No. No, because that's not sterile anymore. No, you cannot. What happens to the blood? Do you put it back in his body so it doesn't go to waste? No, you just discard it. It stays in a bottle and it's discarded. Okay. Sinaksak na. So this is blunt chest trauma. I got another case in the next slide. Another case, and it is penetrating chest trauma. Alright? Alright, next slide. We're going to the next case now, guys. Alright. Okay, we got... The patient is a 1-day-old bred again. Look. And he's complaining. Sinaksak ako. Or I got stabbed. So, nature of the incident. So he got a stab wound. And the time was around 5:30 p.m. a while ago. Today. And place of incidence is some kitchen in Manila. Okay? He got so that's his case. He got stabbed in a kitchen in Manila at 5:30 p.m. a while ago. Okay? And our physical examination. We got physical examination. His blood pressure is 100/70. And then his heart rate is 109. Like I said, normal BP is 120/80. This is actually this is within like a normal, slightly normal. But if it goes any lower, it's too low. Heart rate is 109. Normal heart rate is 60/100. And then respiratory rate is 24, so it's higher because the normal rate is 20. Temperature is within normal, it's 36.8. And his O2 sat is actually 99. It's not really that low. So, he has a 3 centimeter stab wound on his right chest. So here, with retained foreign body, the knife is still there on his chest. Okay? And he also has decreased breath sounds on his right chest. So this is how he looks like. Okay? Alright? I'm gonna repeat the details again, okay? For you guys, so you guys get. So we had a 1-day-old bred a while ago at 5:30 p.m. He got stabbed on the chest. With a kitchen in a kitchen in Manila. Okay. Vital signs are not that stable. He has a BP of 100/70, heart rate of 109, which is too fast. Respiratory rate of 24, which is too high and too fast. Temperature is normal. O2 sat is normal. Okay. And when you look at him, he has a 3 centimeter stab wound on his right chest with a retained foreign body. So the knife is still there, as you can see in this photo. Okay, and when you listen to his chest with a stethoscope, you have decreased breath sounds, or breath sounds are a lot quieter compared to the right chest. The right chest is normal. I mean, the left chest is normal, and the right chest has a less decreased volume of breath sounds. Okay? Alright. So what are you guys gonna do? What are you guys gonna do? I'm gonna look at the chat. Don't remove the knife until surgery. Okay, what else? Would you guys remove the knife right away when you see it? Okay, knife is in the chest. Would you guys remove the knife right away? Let's see. Is it true that no matter where you get stabbed, you should remove the object until you get treatment? What else? Okay. Don't pull the knife. Okay, would you guys... Okay, I'm asking you guys. Okay, some of you are saying don't pull it. Okay. Alright, that's... Okay, okay, no. Okay, I see no answers. No. Okay. Yeah, it's true. You don't pull out the knife right away. Okay? you don't you don't pull out the knife right away. Even if you, let's say this is not an ER setting. Let's say this is not an emergency room setting, okay? If you see a person out in the streets, let's say he got stabbed somewhere. He needs medical attention. You don't pull out anything, any foreign bodies. Don't pull out the knife. He has a knife stuck in his body. Don't pull it out. You call an ambulance. Let the knife or the object has to be pulled out in an operating room, okay? In an OR setting. Not in the ER or not in the middle of the road. Has to be in a in an operating room or a controlled setting. All right. So what would you do? Let's see. Hemopneumothorax. If you drain the blood, then do a surgery to fix the injury. Okay, Patarax got it. Hemopneumothorax. For those who don't know, when you say hemo, that means blood. When you say pneumo, that means air. So hemopneumothorax is blood and air within the chest. And yes, you have to drain the blood and the air. And if there are any other injuries within the chest, you have to repair it or fix that. Okay? Alright, let's go. So yeah, like I said, do not remove the foreign body unless in an OR setting. It has to be done in the operating room. Okay, since the patient is... since the patient isn't that unstable, or the vital signs are more controllable, you can actually do a chest x-ray. A chest x-ray is pretty quick, pretty fast, quick to do in an ER setting. If you tell them, okay, we need a chest x-ray stat, they're gonna start wheeling the patient into the x-ray, and it's just a second to do an x-ray, and you look at the inside. So why would you do a chest x-ray? You want to see how far in the knife is. You want to know where the knife is hitting. You want to know if there's air or blood within the thorax. You'll see it in the x-ray. Okay? And you want to check if the heart was involved, because if the heart was involved, it would be abnormally large in the chest x-ray. Okay? What if it's like a rusty nail? Could it be harmful to your blood? Well, yes. A rusty nail is dirty. You have to have a anti-tetanus booster. Tetanus toxoid booster. Yeah, that's tetanus, man. It's not that it's gonna go to your bloodstream, but it can cause... It will definitely cause some bad infections in your body. Okay. Alright. Okay, we'll go to the next. So, what is the surgical intervention? Let's say he's unstable. You remove the foreign body in the operating room, okay? And then the major procedure that is done in this case is what we call an exploratory thoracotomy or an open thoracotomy, which is an incision is done on the chest. You open up the chest and you have to explore the thorax. So in our patient's case, it's gonna be in the right, and you have to explore. And you also, at the end of the operation, you're gonna put a tube. So, you know, the bread is gonna end up with a tube on his chest again. The patient is here. Hello, bread. Okay. I meant you should remove it as quick as possible. Yeah, if it's a nail, have the doctor remove it for you, because it might have hit an artery or a big blood vessel. Okay. Alright. So we got another happy bread with a chest tube. I just mirrored this because I got too lazy to edit. That's why blood and air is the other way around. Okay. And that is for chest trauma. The two basic chest traumas, like blunt and penetrating. You guys have any questions? You guys have any questions? Sounds bloody. Yeah, it is definitely bloody. when you're dealing with trauma, it is definitely bloody. Forbidden tang. Okay. You guys have any questions? I will answer if you guys have questions. Okay, let's see. What do we have here? Mabuti di pa patay dahil. Strawberry infused bread, yamin. Anong sunod na injury ni bread? Ah, don't worry, we got more. We got more examples. First the left side, now the right side. Yep. We got more examples. Bread involuntarily volunteered for this, so yeah. He was a good volunteer for my medical education stream. Let me see. If we were not a pro, can we do this thing IRL? Of course not. I actually I have a medical education stream before about first aid. We can probably go through that later if I still have time. Okay. Okay. How do I deal with hemophobia? I get dizzy and sometimes faint. Help. Actually, to be honest, there are the actual doctors who have hemophobia. Especially the ones who are not surgeons. When they see blood, they faint. It's something you just have to get used to. Will there be a quiz after? Actually, when I ask you what you guys are gonna do, that is your quiz. Is it possible, doctor, that I fractured rib cage in my trauma? That's already an example of trauma. For example, if you have a blunt chest trauma, like what I said a while ago, it's possible to have a fractured rib. But usually fractured ribs, you don't really do surgeries on that. They're usually not too major because the ribs are small compared to the other bones of your body. Okay. Alright, we're gonna go to the next case now, okay? So, next is abdominal trauma. We're done with the chest. I see a lot of abdominal... So, chest trauma is very, very common in the ER, as well as abdominal trauma. These two are the most common ones we see in the ER. That's why I focused more on these two. Okay? Alright. Alright! Next case! Next case. The patient is again a one-day-old bread. One-day-old bread. What happens is, okay, the nature of the incident is a vehicular accident. VA is short for vehicular accident. Okay, so let's say bread just got run over by a bread got run over by a car. Okay, at 4 p.m. a while ago in EDSA. Okay? He got run over by a car in EDSA. Alright. Okay, our physical examination, you guys. Okay. This is, you know, bread is everywhere. He was in Tondo. And he was in Manila, now he's in EDSA. Alright. Vital signs. His blood pressure is 120 over 80. His heart rate is kind of fast. It's 110. Respiratory rate is 21. His temperature is within normal, 36.8. Oxygen saturation is 100%. Okay. So what do we have? We have a 8 by 6 centimeter this bluish discoloration on his left hemi-abdomen. So here, this is it. Okay? And when you palpate or when you feel his abdomen, his abdomen is soft when you feel it, when you palpate it, but it is tender on the area of discoloration. That means when you press on this area, it's painful for him. He would umaaray na siya, or he would yelp in pain. Okay, so he comes in here, he's complaining that his stomach hurts. Okay? So, let's go through this again. We got a 1-day-old Bread a while ago at 4 p.m. He got run over by a car in EDSA because he was crossing the street without looking. And then his vital signs, he has his BP is 120/80. Heart rate is 110. Respiratory rate is 21. Temperature is 36.8. Oxygen saturation is 100%. And he has an 8 by 6 centimeter bluish discoloration on the left hemi-abdomen. When you say left hemi-abdomen, it's on the left side of his abdomen. And when you feel it, he has his abdomen is soft on palpation with a direct tenderness on the area of the discoloration. So that means when you press on it, it's painful. Okay. Yeah, when you do a physical, feel his abdomen, diba masakit nun? Yeah, when you do a physical examination, you have to do this, even if it's painful. Okay, it's important for a doctor to do a very good history and physical examination. Okay. Wait, if a car runs over your abdomen as you're made of steel, you're kind of dead, ain't you? No, actually, not really. There are people who survive getting run over by cars. There are people who still do. They come to the ER and they're still alive. They don't... Not everyone dies instantly. Okay? Alright, next slide. What are you guys gonna do now? Given this patient. What will you guys do now? Are you guys going to do surgery on Bread right away? Or are you going to request for, let's say, x-rays or a CT scan? Or ultrasounds? What are you guys gonna do? Or like, you know, any imaging? What are you guys gonna do? What are you guys gonna do? Bread is not an ordinary bread. Press his abdomen, aray. That's actually what happens. But you know, you really have to do a physical examination. Ipahilot si Bread. Ipahilot. Pahiran ng efficacent oil. Vicks. Vicks lang ang ano katapat niyan. Vicks cures all. Give pain meds. Yeah, okay, that's one thing. You can give pain relievers. No longer operate ang stubborn ng Bread. That's true. Ilang beses na nabugbog si Bread, buhay pa yun. No? Check airway. Yeah, that's actually, yes. That's like if you're in the medical field, the very first thing you do in trauma is check airway. But then since I'm doing this for like, you know, not for medical students or medical, you know, people, I'm doing this is very, very summarized for a layman. Because if I go through all the, you know, the ABCs of this, it's gonna take forever to explain everything. Pagmamahal mo ata kailangan. Oh my god. Alright. Okay, I'm laughing at all your answers. Okay, a lot of you mentioned X-ray, CT scan. Lagyan ng dahon ng bayabas. Some of you say no longer operate. Okay, I'll tell you what we do, okay? Since Bread is stable, kind of, if you look at it. He's somewhat stable. He just has a high heart rate. He probably has the high heart rate because of pain. But otherwise, everything else is fine. You can do imaging first. So, one of the imaging we do in the ER is called a FAST. It's an ultrasound of the abdomen. It's called FAST for Focus Assessment with Sonography in Trauma. That's the acronym. I do this a lot, actually. We just get an ultrasound machine and then place the probe in the abdomen. The purpose for this ultrasound is to see if there's fluid collection. When you say fluid collection in trauma, if there's fluid collection, that means there's blood. There's blood there. So you check there are 4 areas you check in a fast, which is on the right upper abdomen, the left upper abdomen, the heart, and the bladder. Okay. Another one is more of a CT scan, not really X-ray. Okay, we do an abdominal CT scan. So what you need to do, why do you do these diagnostics? What you want to look for is if there is any internal bleeding. Internal bleeding especially. Because that is the one thing you have to address. The most important thing you have to address, internal bleeding. Other than that, aside from internal bleeding, even spillage of gastric contents or intestinal contents, like if your intestines or your stomach gets perforated because of the trauma and then the contents spill inside your abdomen, yeah, that needs repairing, that needs surgery. Okay. Is the fast? Yes, actually that's why it's also called a fast, because you do this fast. As soon as you have the ultrasound, you do this right away. You can do it really quickly, because all you're looking for is just fluid. That's it. Is fast and reliable? It's reliable in looking for fluid. Okay, if the patient has trauma, or trauma at the abdomen, this can at least tell you if there is fluid accumulation. It is fast. I can do this in like skilled doctors can do this in like a few seconds. Maybe like 10-15 seconds. As long as they see what they need to see, they're good. It can take me like 30 seconds to do this. Okay. Alright, let's see. If the patient is stable, other things you can do is observe the patient also. Okay? So observe. Let's see. Also, I have a question with that too. Don't all organs have their own specialized linings? Why would a bunch of blood inside your body be so bad? Okay. Why would a bunch of blood inside your body be so bad? Okay, if there is blood within your body, that means there is a blood vessel injury. Okay? There is a blood vessel injury, and if that blood and vessel injury is not addressed, you would keep bleeding inside your body. Yes, you would keep bleeding. And if you keep bleeding, you become anemic. And when you become anemic, you can die. That's actually why. Okay? Even if the blood... that's why it's bad. You can bleed to death. The bleeding doesn't go outside of your body, it stays inside, but you're still bleeding inside. Okay? Okay. Now, what if... when do you do immediate surgical intervention? You do this when the symptoms of the patient worsen. So let's go back to Bread. Oops. Bread says his stomach hurts. And he noticed that, when you palpate his abdomen, when you feel his abdomen, it's soft. It's soft, and it's and the tenderness or the pain is on the area of the discoloration. Now, if the pain or the tenderness is outside the area of discoloration, let's say it's already on the right upper abdomen or the lower abdomen, that means, and his abdomen becomes rigid or hard, not soft anymore, then that means there is something going on in there that requires a stat surgery. Okay? That's why if symptoms worsen. Patient becomes unstable, so he can go from, let's say, a BP 120/80. All of a sudden, like after an hour, his BP drops, his blood pressure drops to 80/50. Well, that means something's going on. And then his heart rate would raise to 120. And then his temperature suddenly rises to 37.9. That would be unstable vital signs. Alright, that means you have to do a surgery. Because there's something going on inside his abdomen. Right? Positive findings on fast or CT scan. Like I said, if there's fluid in the fast, or if you see any blood in the fast or CT scan, that means he has bleeding happening in there and he needs urgent surgery. Okay? Doesn't your blood vessels heal? Like clots don't happen inside your vessel? Yes, that it can happen, but if the blood vessel is an artery and the pressure is too high, because arteries have higher pressure, they can break the clots, so they will just keep bleeding. They will keep bleeding, especially if it's a very big blood vessel. Let's say in the abdomen, the largest blood vessel in the abdomen is the aorta. So if you have, and the aorta has a very high pressure, so if you have a perforation or a rupture in the aorta, blood clots is not enough to stop that. Okay. Is fast can be used in any parts of the body? Nah, it's usually used in the abdomen and the chest. That's it. Okay. Alright. Next, what is the surgical intervention? It's actually an exploratory laparotomy. So you have to incise the abdomen in the middle. It's gonna be a very big incision from the upper abdomen up to the lower. And when you open up the abdomen, what you're gonna do is look for any bleeding. If there's a lot of blood clots, you have to take those blood clots out. And you have to control the bleeding. You have to look for the source of the bleeding, because even if you remove all the blood that you see, if you don't control the source of the bleeding, he's still gonna bleed. Once you find the source of the bleeding, you can let's say it's a blood vessel, you just need to repair that. Okay? And address any spillage, meaning any perforations in the intestines or the stomach. Sometimes the stomach can have like because of the trauma, they could burst or have a hole, and then whatever's inside, whatever you ate or drank, spills into the abdomen. You have to evacuate that and then close the perforation. In the case of intestines, if the perforation is way too big, you have to remove that segment of the intestine. Okay. Also, I hear your keyboard. My keyboard is it's a mechanical keyboard. Alright. How do you handle a head trauma injury, doc? Yeah, I have that later. I'll talk about that later. Who does or performs the fast scans? Okay. Emergency doctors do that. Fast emergency doctors. It can also be the surgeon, because we also handle trauma. It can also be done by the radiologist. So yeah, but if you want it instantly, it's done by whoever's in the ER. We're trained to do fast. It's an easy procedure. It takes a few seconds. Okay. Bum bum. Ba 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 ba. All right. Okay. What's this? 4 packs. What? What the heck? What the heck? Why is Putin in my stream? All right. Okay. Do you guys have any questions? Because basically that's blunt abdominal injury, that what I presented to you guys. Okay. It's a blunt. It's a blunt abdominal injury. Sounds fragile but fast. Yeah, well, that's what fast ultrasound is. You guys have any questions? I'll answer them while we're here, because the next one is gonna be about penetrating abdominal injury. Okay. Is the bread happy in the next frame? Actually, no, I didn't put a happy bread in the next slide. Okay, if there's no questions, we'll go to the next slide, okay? Alright! The patient is a 1-day-old breed. Alright? Nature of incident, gunshot wounds. So this is his 4th injury, actually. Alright? He got shot at 8 p.m. a while ago. Place of incident, somewhere in Twitch. He got shot in Twitch. He got shot while streaming Twitch. Okay, and he was complaining that someone starting with help binaril ako ni She. He couldn't complete his sentence because he fainted, but he's still alive. Okay, he's still alive. Yeah, he got shot on Twitch. All right. Physical examination. Physical examination. Okay, we got his blood pressure is very low. His blood pressure is very low. It's 80/50. Okay, 80/50 BP, and his heart rate is 118. 118 beats per minute. And then his respiratory rate is 24. His temperature is okay. It's 36.9. Autosat is 98%. Alright. Now, for the physical examination of his abdomen, we have three 1 centimeter gunshot wounds. Okay, with a point of entry in the anterior right hemi-abdomen. So that's the front here, in the right hemi-abdomen. And the point of exit is on the right lumbar area, or the back here. This is where they exited. So that means all the bullets are not, there are no retained foreign bodies, basically. And when you palpate his abdomen, it's rigid, it's hard, with tenderness on all quadrants. So if you divide the abdomen into 4, it's hard or painful on all areas of his abdomen. Okay, so I'll repeat again. We got a 1-day-old Brit complaining that someone shot him. Rainer Hart, thank you for the sub. Okay, and he sustained 3 gunshot wounds a while ago at 8 p.m. in Twitch. In Twitch. Alright, his vital signs 80/50. Okay, heart rate is 118. His respiratory is 24, temperature is 36.9, oxygen is 98%, and he has 3 1 centimeter gunshot wounds with points of entry in the anterior right abdomen. So anterior meaning in the front, and it's on the right of his abdomen. Points of entry, so they entered through his front and exited through his back. Okay, and when you palpate his abdomen, it is rigid and there's tenderness everywhere. There's pain everywhere. Okay? So, what are you guys gonna do with this bread? I'm gonna read the chat. What are you guys gonna do this time? Let's read the comments. He got hit by a car, stabbed, now he gets shot. Yes! Immortal bread. He fainted. Yes, he fainted when he tried. He was going to say the name of the person who shot him, but he couldn't say it because he fainted. But he's still alive. He's still alive. Okay. Bread greater than Cardo Dries. Wolverine bread. Baka naman may galit yung mga gumaganyan kay bread. Same procedure ba po yan if someone's stabbed by an ice pick? Yes, actually, if you were stabbed by if a stabbing was done by an ice pick, it's a penetrating abdominal injury. So, actually, it's in the same. If you were stabbed by a knife on the abdomen or by a ice pick or shot in the abdomen, it's considered a penetrating abdominal injury, and the algorithm would be the same. Okay, I think you should stitch the wounds and then patch him up with bandages. Gary the Goose, thank you for the sub. X-ray, then operation. Maybe do an MRI scan to see if the organs are severely damaged. Bury him alive. Dasal. Prepare for funeral. Euthanasia na. We don't do euthanasia here in the Philippines though. That's illegal. Ilagay sa oven. Moral of the story, wag bubuo ng harem. 1 cm gunshot, either a .4, you know, it doesn't, as long as it's a penetrating injury, the management or what you do is the same, actually. Almost the same. X-ray. Okay, people are saying X-ray first, or basically. Everyone is doing X-ray first. Alright. Okay, rule of thumb. Rule of thumb. X-ray for bullets. It's the bullets already exited his abdomen. He got shot in front and then they exited outside, so there's no fragments. Or there's no bullets inside. Alright. Rule of thumb, guys. Rule of thumb, when you have a penetrating abdominal injury. Penetrating meaning the object used to injure the patient enters the abdominal cavity. That is a penetrating injury. Unlike in blunt injury, there's no open wound. It's just a bruise. It's just a bruise, okay? But then you can have no injuries inside, or you can have actual injuries within the abdomen. But in a penetrating abdominal injury, when you think of the abdomen, there are a lot of organs within the abdomen, right? Like on the upper abdomen, you have the liver, you have the stomach, you have your pancreas, you have your spleen. And in the middle of your abdomen, you have your small intestines and your large intestine. And you'll also have the urinary bladder in the lower abdomen, aside from other parts of the small and large intestine, and your rectum. Okay? So, rule of thumb when it comes to penetrating abdominal injuries, right? You do an immediate surgical intervention. Because the injury is penetrating. Definitely you got something. You will definitely have an internal injury. More likely than not. Okay, unlike in blunt where there may not be internal injury. Especially when you look at the physical examination of Bread. He has a rigid abdomen with tenderness in all quadrants, and his BP is very low. It's 80/50. Okay, and his heart rate is kind of high. Okay? So it's an immediate surgical intervention, guys. Exploratory laparotomy, like I explained a while ago, where you have a long incision on your abdomen. Again, you control the bleeding if you see any and address any spillage. In penetrating abdominal injuries, usually the injuries are depending on the location of the injuries, or the stab, or the gunshot wounds. If it's in the middle of the abdomen, it's usually intestines that are perforated, so you have to repair those, or you have to remove that certain segment of the intestine. If the injury is way too big or multiple in one segment, you have to remove the entire segment of that intestine, and then after you remove it, you have to connect the two ends together. So it's kind of like plumbing. Remove one part, and then connect them. Okay. I have an abdomen. Yes, Brent, you do. I gave you an abdomen. You got shot. You got shot. In the abdomen. Okay. You have an immortal body. Yep. Brett actually has okay, yeah, that's the last slide for penetrating abdominal injury. So you guys have any questions? If the weapon was an ice pick, it's the same. Even if it's an ice pick is very thin, but you know that it's sharp and it's long, so it can enter the abdomen. Something as small as an ice pick can already cause a perforation and bleeding within the abdomen. So Injuries caused by an ice pick, it's still a penetrating injury. You'd still need surgical intervention for that. Okay. What about trauma sa pag-breakup ng GF daw pwedeng surgery? That doesn't need surgery. Ang kailangan, pag ganyan, hanap ka ng ibang babae. Siya yung a new girl can heal you. Hanap ka ng ibang girlfriend. Hanap ka ng bagong girlfriend. Or, dito ka lang sa mga streams ko. Have you reattached an intestine before? Yeah, it's called, we call that, let me, wait. Pin. When you attach an intestine together, it's called anastomosis. This is the term used when you when you put together intestines. Anastomosis. So in short, to rebound. Depende sa inyo. Like, I don't know. Bruh. Pwedeng hanap kayo ng bagong girlfriend or dito lang kayo sa stream ko. Some people follow this 3-month rule. I don't know. Okay, anyway, yeah, anastomosis. This is what you call the connect when you reconnect intestines or any parts of the bowel. It's not gram spatching. Gram spatching is different. Gram spatching is like if you have I'm gonna show you expensive God, this is an ugly stomach. Gram spatching is when you have a perforation in the stomach. Let's say this is a perforation. You put there's a thing called the omentum, which is like a dress of fat. What you do is get a piece and then you just cover the hole. That's gram spatching. That's different. But you can do that. You can do that, let's say, if there is a gunshot wound. Let's say he got or a stab wound. He got stabbed in the stomach. And the only injury is here in one side of the stomach. That's it. You can do a gram spatching. You can do that. It really depends on the extent of the injury. Okay. Alright. I hope you guys understood that. You patch up wounds with grams. It's called a mental patching or grams procedure. That's the proper name for it, grams patching, but it's also called a mental patching. A mental patching. Stomach can be patched, yeah. I think my last medical stream about the stomach, I talked about that actually. I talked about that. We can actually, I think we'll have time to go through my old medical education streams. Like, I think we can go through more trauma injuries. I remember doing a PowerPoint about burns. Okay. Any more questions about abdominal injuries? Mango, grams, wheat bread patch. Okay. No more questions. We're gonna move on. We're gonna move ahead, okay? The next topic is head trauma. Alright? Head trauma. Effective ba ang omental patching para sa sira kong puso? Omentum is in the abdomen. Yung puso na sa dibdib. Malayo siya. Alright. Next. Okay, we got a new patient. Apparently, Bread has a quota Fred is a quota for injuries already. He got injured 4 times in the stream. So we got a new involuntary volunteer for this next case, okay? So we got a new patient who's a 26-year-old common rider. Okay? 26-year-old the 26-year-old common rider. So he got mauled. Okay? A while ago at 3 p.m. he got beaten up in Twitch. Okay? Apparently what happened is his viewers on Twitch kept shooting him with a pellet gun. And he suffered head injury. He suffered a head injury. Okay? So, he just came to the ER and started telling me, you know, we can still collab Elden Light 2 later. he got disoriented apparently. I think he meant Dying Light 2, but he also wanted to play Elden Ring and he got mixed up. He called it Elden Light 2. Alright. So, physical examination for this poor patient, this new patient here. Laser pointer again. Alright. So many things happen. Context for that. This guy has a redeem on his Twitch channel where you can shoot him. You can shoot him on his Twitch channel. So a lot of his viewers shot him a lot, so he got this. Alright? So his blood pressure is 120/80. Alright? His heart rate is 89. His respiratory rate is 20. Temperature is 37. And his O2 sat is 98%. Now, this is a head injury, so this is a little more complicated. Okay? This is a little more complicated. Now I introduced a new thing here called GCS 13. I will tell you what GCS is, okay? This is a very useful scoring technique. I'll write it down. Where can I write GCS? Here. GCS. The scoring of GCS is 3 up to 15. Okay? What does GCS stand for? GCS stands for Glasgow Coma Scale. Okay? GCS. So when you say GCS score 3, you have values 3 to 15. When you say someone is GCS 15, that means that's actually normal. That is the only normal value, 15. Any lower than that is not normal. So he is GCS 15, meaning that he would open his eyes spontaneously. He can answer questions spontaneously or speak spontaneously. And he obeys commands. Alright? There's a scoring for that. Now in this case, the lowest score is 3. If you're a GCS 3, that's basically comatose. Okay? 15 is normal. Alright? 3 is the lowest. So 15 is the highest, 3 is the lowest. 15 is normal. And the worst score you can have is GCS 3, which is comatose. Alright, so in his case, in this patient's case, his GCS score is 13. Where is it? Here, 13. So what happens is he's awake, he's alert, but he says inappropriate words like this. He says we can still collab Elden Light 2 later, right? But he follows commands. He just doesn't know what he's saying. Okay. The higher the better. Yes, the higher the score the better. Okay. He's not normal. It's not normal because he's 13. 15 is the only normal. If you're 15, you're good. But any lower than that, it's not normal. Okay. So, he's a GCS 13. Now he has a contusion on the right frontoparietal area. What do you mean by front? It's just an anatomical position, but when you say fronto, that would mean the forehead, at least towards the forehead. Parietal is towards the side, that's why frontoparietal area. Here, on the right. Alright? No sensory motor deficits. That means, his movements are still strong and he doesn't feel any numbness anywhere. Okay? May bukol yung helmet. Oo nga, may bukol yung helmet. But 15 is underage. Brad, what are you talking? What do you mean 15 is underage? Bruh. Bruh. Okay. Tan. Nagkabukol yung helmet. Okay. So, I'll repeat that again, okay? We have a 26-year-old Kamen Rider who got beaten up by his viewers in Twitch at 3 p.m. today, okay? And came to the ER saying he wanted to collab Elden Light 2 later. His physical examination, his vital signs are the following: 120 out of 80, heart rate is 89, RR is 20, his respiratory rate is 20, temperature is 37, and oxygen saturation is 98. So actually his vital signs are normal, but his GCS is 13, which is not normal because the normal is 15. But he is awake. He's awake, but he's disoriented or just says inappropriate stuff. He doesn't understand. Okay, and then he has this on his head. Okay. Alright, so given that, what are you guys gonna do? What are you guys gonna do when you get a patient like this? I mean, I'll wait for the chat. What are you guys gonna do? Let's see. Nagkabukol yung helmet. Pre, yung helmet may bukol, dalhin sa ear. What will you guys do if you have a patient like this? I'm gonna wait for the chat to see what you guys. I'm grading you guys, by the way. I'm grading your answers. MRI scan. Palitan yung helmet para wala nang bukol. MRI. Give them cookies, x-ray sa ulo. Finish the job, beat him up to score 3. Put cold compress. Lagyan ng piso para di bumuko. Lagyan ng piso para di bumuko. Bruh. Check his insurance. What would GCS of something like 8 look like? Okay, I'll answer that question later. Hilot. Tanggalin yung bukol kanina. Oh my god. Pati utok nagkaroon din ng bukol. My god. Okay, guys. CT scan. Okay, only one person answered CT scan. The rest are MRI. Okay, okay, next. Okay. When you receive a patient with head trauma. When you receive a patient with head trauma, the first thing you do is request a cranial CT scan, okay? Not MRI. MRI is more expensive, and as far as I know, MRI takes longer. You need something that is quicker. CT scan is a lot quicker, and it's enough to identify where the bleed is. Although MRI can be done, but it's more practical to use a CT scan. Okay? So, you do a cranial CT scan. What you're looking for in a CT scan is any bleed in the brain and for a skull fracture. Right? what you'll see you should do is observe him. If there's any decrease in sensorium, meaning if his GCS score gets even lower. Okay? Because his score can get lower. His at 13, right? If it gets any lower, that means there is ongoing active bleeding in his brain. Okay? So here we go. If the CT scan is positive, meaning there is a bleed, you have to do a surgery depending on the size of the bleed. So craniotomy, meaning you have to open up not really open up the skull, but you have to put a hole in the skull and drain out the blood. If there's a skull fracture, you have to elevate the fracture, especially if it's a depressed skull fracture. Depressed skull fracture meaning like the skull, the fracture here, there's cracks and it goes downwards. The fracture's downwards. Unlike here, like this one is slightly downwards. This one is straight. If there's a fracture but it's like this, it doesn't really need surgery. But if the fracture goes downwards or caves in, then that one needs surgery. Okay? Alright. And if the CT scan is negative, let's say you did a CT scan, but there's no fracture or there's no bleeding, then you have to observe the patient. Okay, you can't discharge him or you can't let him go home because he's GCS 13. The only time you can actually send them home is when they're GCS 15 or within normal. Okay. Is there drilling involved? Yes, actually there's this thing called a burr hole. It's like a drill but manual. You just drill a hole on the skull. That's where, like for example here, let's say you have a bleeding here, you just put the burr here and then you drill the skull and then you make a hole and then you just evacuate the blood. Okay. Now wait. If there is decrease in sensorium, let's say his CT scan's negative and decrease in sensorium. Okay, GCS 13, he went down to, let's say, GCS 8. Okay, when he goes down to GCS 8, you do a repeat cranial CT scan or a repeat scan. And you prepare for surgery, okay? The reason why you do a repeat scan is because you want to see the progression of the bleeding. So there might, if there is a decrease in the sensorium of the patient, most likely there is an increase in the bleeding and you have to catch that. And then you have to operate on that. Okay. Kung di kaya drill, pwede pickaxe, bruh. Bruh. Okay. Now, someone was asking me about GCS scoring. I'll give you more detail about GCS scoring. Okay, let's look for here. I'll write down here because this one I have space to write. Someone asked me about more info for GCS scoring. So, for GCS, you have a score of the range is 3 to 15, right? GCS is divided into 3 criteria. One is eye opening, and then one is vocal output, so speaking, and the other one is movement. Okay. So, the score for each, for eye, you have the highest score you can have for eye is 3. And then the highest score you can have for the vocal is 4. And the highest for... Oh wait, I'm wrong. No. Not 3. This is supposed to be 4. Sorry, I'm wrong. This is supposed to be 4. Sorry. I am wrong. Mali. Erase. Okay, let me do that again. For I, it's 4. Sorry, 4. Vocal is 5 and movement is 6. Okay, there we go. If you add all of this, 4 plus 5 plus 6 is 15. So if you have the highest score for each, then you have 15. Okay? Their lowest score for eye-opening, the highest score, which would be 4, is due to spontaneous eye-opening. The same with vocal. If you can, if they answer coherently or they're oriented, that would be a 5. Movement, they would obey commands, that would be a 6. Alright? When you say GCS 3, eye-opening would be 1, meaning they don't open their eyes at all to any stimulation. Like if you call them, or if you tap them on the shoulder, or, you know, induce pain, they don't open their eyes. Same way with vocal. They don't answer you. They don't answer you, so it becomes 1. And the same with movement. It becomes 1 because they don't react. Okay? Walang GCS 0. No, the lowest is 3. Because the lowest score you can get for this is 1. Each of them 1. And it will be 3. Okay? GCS 0 dead. Actually, technically GCS 3 would be dead. There is no GCS 0. Okay? So the lowest is 3. So someone asked, what was the question a while ago about GCS 8? How does a GCS 8 look like? So if you have a GCS 8, it depends on what this look like. So GCS 8. GCS 8. You can have a 4 on eye, so he would open his eyes. You can have a 2 in vocal, meaning this patient will not answer you unless you induce pain or make any sounds. He would just moan, that's it. Movement can be 2 also, wherein they just make this certain what do you call this, flex to pain. That would be an 8. Or you can have it can be a 3 here, 3 3 2. You know, it can be a mixture of any of this, combination of any of this to have an 8. Really, that's basically it. You can have a 1 here, and a 6, and that's still 8. That's the GCS score of my late dad is 3. Oh, okay. Oh no. Yeah, the 3 would be comatose. Can someone can't talk but do some movement, open their eyes? Yes. You can be a vocal 1, open their eyes spontaneously. This could be a 4, and do some movement. Yes, let's say obeys commands but doesn't talk. That would be a GCS 11 total. See? Or you can have eye opening to name calling when you called out their name but not talk. Movement, movement to pain. That would be a 4. That would be an 8, GCS 8 actually. Have you ever seen someone with like GCS eye, 1 vocal, 6 movement? Yes, actually, yes, I have. Now, usually, okay guys, let's clear this up. Usually in if the patient comes in, let's say Rion came in here, but let's say this thing here, let's say instead of GCS 13, he came in as oops, wait, hold on, what happened? Pen, okay. Instead of GCS 13, let's say Rion came here as GCS 3. If Rion came here as GCS 3, then he wouldn't have eye opening at all. He would be he would not even be saying this. He will not be saying that. He will just be quiet. Vital signs can be within normal. He wouldn't be awake, this guy. He would be comatose. He wouldn't be comatose. Let's say he came in like that. If a patient comes to you after head trauma and he is a GCS3, they don't, neurosurgeons don't operate on this anymore. When you're a GCS3, they don't, no surgery is done, because when you're a GCS3, that's very low prognosis, very bad prognosis. Basically, it wouldn't matter whether you did an operation on the GCS3, the result won't change, because they're already comatose. Okay. Okay. I have decided I'll be a regular here. I'm relearning stuff I almost forgot. Thank you, but yeah, I only stream here once a month though. I only stream here once a month, unfortunately. I usually stream on Twitch, actually. That's where I am. Medical educations, I do it here once a month on YouTube. At least the ones with a set topic. Okay? Alright. Other types of trauma, which I didn't cover because I don't really see much of the... well, I do see them, but they're not as common as chest and abdomen. Neck injury. Alright. Neck injury is very complicated, actually. If I will, let's make a drawing. Neck injury is quite complicated. If I will draw the neck of a person, let's see. Let's see. I'm gonna draw a neck of a person, man. So that's a neck of a person. The neck is divided into 3 zones. Here. This is zone. Shoot. Ah. Wait. Where's your bird dog? My bird's still here. She's just quiet now. She's quiet now. she's still here. She's just quiet. Okay. The medical world is ruthless. Yes, it is. It is ruthless indeed. It is very ruthless indeed. So anyway, yes, as I was saying, the zones of the neck, we have 3 zones of the neck, okay? This one would be zone 1, this is zone 2, and zone 3. It's actually complicated, and depending on where the injury is within this neck, it depends on what you're gonna do. For example, if you got stabbed on the neck here, and it also depends on the symptoms. If you get a stab wound here, let's say you get stabbed in the neck, there are what we call the hard signs, which is basically any signs of active bleeding, like pulsating bleed, pulsating bleeding, or what do you call it, an expanding hematoma, meaning there's a hematoma or a bruise that's getting bigger very rapidly. Hematoma, any signs of active bleed. And you know, the structures that are in the neck, there are a lot of structures, there are a lot of vessels here. We have especially the carotid arteries, they're there. If you get injuries in the carotid arteries, you can bleed out. And then in the center of the neck, you also have the trachea. The trachea is where connects to the lungs. There's also your esophagus. Okay? So a lot of structures can be injured in the neck. It can be the carotid artery, or it can be the esophagus, and it could be the trachea. Alright? So it's actually complicated, neck injuries. If you have a bleeding, or if you have a carotid injury, you have to repair that. Another vessel that's here is the internal jugular vein. This is another large vessel. if you have an injury to the esophagus, depending on how bad it is, you have to repair that, and that usually includes getting a part of an intestine from the abdomen to fix the esophagus, and that's a very major surgery. Yeah. And on the trachea, if you have an injury to the trachea, you might have to go through undergo a tracheostomy, which is where they put a tube in the trachea so you can breathe. Yeah. A lot of structures are very vital structures are in the neck. That's why you know, when you watch movies and they want to kill someone, they just slice them in the neck. Quick way to die. Because a lot of stuff are there. You can either bleed to death or you lose oxygen because there's a hole here, or you perforate the esophagus and suffer from an infection. Okay. Cut of carotid artery leads to stroke. No, stroke is a totally different thing. Cutting the artery just causes hemorrhage. You just bleed out. A stroke is different. Okay. Now you know why military armor extends to the neck. Yes, because neck is there are a lot of vital stuff in the neck. Okay. Now, fractures and dislocations. Since I am a general surgeon, right? We don't handle fractures. So any trauma to the limbs, or if there are any fractures on the bones, I don't handle that actually. It's orthopedic surgeons who handle that. So orthopedics. These guys are the specialists for bones. They handle those stuff. Dislocations, fractures, they handle that. I don't. So when it comes to dealing with fractures and dislocations, I am not that well versed there. I can identify a fracture, but then the management, I have to refer to an orthopedic surgeon. Okay. Pag binalian ng leeg, di ba automatic dead yun? No, not really. If you have a spinal fracture or a cervical fracture, so in the neck you have a spine, the cervical spine. If you have a fracture there, you don't necessarily die, but any injury to the spinal cord at that level, you can lose your ability to move. Okay? You can lose your ability to move. You might be able to like speak, open your eyes, breathe. Actually, breathing might be questionable because eventually that might give up. You don't die right away. Okay? It's more complicated than that. Alright, burns. Burns is part of trauma. Okay? I actually have a medical education stream about this before. I can probably get those slides out again. But burns are depending on how bad the burn is, you can manage burns very conservatively. If you have flamazine cream, you can use that, or silver sulfadiazine cream. Sometimes you need to do a debridement or clean it in the OR, the operating room. Oh, and I forgot, there is also classified under trauma is caustic ingestion. Caustic ingestion. To be honest, this kind of stuff, I really don't like dealing with these. These are very complicated ones. When you say caustic ingestion, these are the people who acid base. These are usually the suicidal people. The ones who drink like liquid sauce or drink some kind of Zon rocks. You know, those they want to kill themselves, so they drink whatever acid or whatever liquid detergent they have at home or anything. I really these are complicated to deal with. They are very complicated to deal with. It's delicate. There we go. That's the I really don't like dealing with these ones. These are really hard to deal with. Because one, you have to know what they took, how much they took and why they took it and when they took it. And sometimes when you talk to them, they don't, parang nahihiya sila. They're embarrassed about it because, they tried to kill themselves. Okay. Like, I've had numerous patients who tried drinking liquid sosa. It is annoying. To be honest, I get irritated. Sprite. Sprite. Bruh. Okay. Minor trauma. This one is like, I get, these are the majority of what I get. Minor trauma. Wait, let's clear this up, okay? There we go. Minor trauma. Minor trauma meaning those people who get into accidents but only get minor injuries. So let's say they get lacerations on like their head or their arm. You just suture that up. They just suture that up. Sometimes I had one patient. It was a kid. This kid tripped and fell and grabbed onto some wooden bar or wooden something wooden to prevent himself from falling to the ground. But then what happened was when he grabbed that piece of wood, which looked something like this. Where is it? This. When he grabbed that piece of wood, there was a nail on it, sticking out like this. It looked like this, okay? It was like that. And then he grabbed it. I don't know how you draw a hand. He grabbed it. Ang pangit ng kamay. He grabbed it and this part of the nail got stuck in here. It got stuck here. It went through his finger. So when he went to the ER, he came to the ER holding the wood, and I was like wondering, why is this kid holding this chunk of wood? And apparently it's because the nail got into his hand. Drove into his hand. Yeah. So I had to remove that. Okay. I had to remove that, making sure I don't break anything. I had to take an x-ray of this just to see if the nail drove into the bone. And he was lucky that the nail did not go through the bone. He was lucky. Okay, he was lucky. All I had to do was like how do I draw a hand here? I can't draw a hand. Ang pangit ang drawing ko ng hand. So let's say the nail is like that. All I had to do was just make a small incision here and then pull the nail out or pull the wood out. The kid wasn't holding the wood. The wood was holding. Yeah. Okay. The kid was okay though. He's lucky that it did not enter through the bone. He's lucky. Alright. That's the last slide actually. That is the last slide. King in a dude. Alright, you guys have any questions? I can't draw hands, I'm not an artist, man. I'm not an artist, so I can't really exactly draw. Sorry na. Alright, do the summary as a quiz. Okay, hold on. You want me to do... What time is it? It's 10:11. Actually, I've been streaming for quite a while. Hold on. Alright. But we're done. Okay. Wait, I should have my clinic as the... This should be my BG. There we go, clinic. Oh god, the chat on my chat box is so white. Shiori art stream, let's go, bruh. Can't do an art stream. Oh no, it says Minecraft art outbreak. So do you guys have any questions? You guys have any questions? Oops. Pwede ba akong magpa-opera kapag katapos ng stream? What kind of operation do you want? The circumcision or something? Tuli stream. Tuli. Thank you for the medical stream, Siri. You're welcome. Art stream. We'll see. I'm bad at art. I remember working in a hospital before as a staff and I saw some things you mentioned. Yeah. Especially trauma. There's a lot in the ER. Are caustic ingestion common, seeing that you're irritated? And it's not as common as the ones I mentioned, like the abdominal and chest trauma. It's actually it's not that common. Not really. But it's just that it's very irritating when I get that because they're difficult to handle. It's more complicated. Ito naman natuloy ka na sa isip. Bakit? Okay. You guys have any questions? Should I give a quiz again? Should I give a quiz? Okay, fine. I'll give you a case. I'll give you guys a case. Let's see if you guys learned anything. Let's see if you guys learned anything. Hold on. Let me MS Paint. Since parang gusto niyo yata ng quiz eh. So I will give you guys a quiz. Hehe. Tulian mo nga si Bruh. Okay, I'm gonna give you guys a case, okay? Let's see. Hold on. Let me think of a case. Hold on. I want to know after what you guys are, what would you do if you got a case like this? Wait, hold on. Let me draw. let me write. Let's say we got who do we use as an example? Okay, let's use Rian as an example. So we got a 20. Oh shoot! Why is it not writing? Why is it not writing? Oh, there we go. Okay. So let's say we got a 26-year-old common rider. 26-year-old common rider. Okay. Open notes. And then he came in. Let's say nature of the incident is wait, you know what? Why am I even writing? I have a text here. Teka. I can use text instead of using my ugly handwriting. Bruh. Yay, we have a 26-year-old. Tayo na, ba't ganyan yung font ko? Let's use a different font. Comic Sans. 26-year-old Kamen Rider. Okay. And the nature of the incident, okay, was gunshot wound. Gunshot wound. when it happened. It happened. Let's say it happened this morning, 8 a.m. this morning, and then it happened in Doi. Doi is Feb 28, 22, and it happened in Makati. Makati. Okay. Comic Sans number 1. Okay. All right. Now is a physical examination. Okay, his BP is, let's say his BP is 70/50, and then his heart rate is 120. His respiratory rate is 24, and then temperature is like 37. O2 sat is say 98%. And then he has 1 centimeter gunshot wound on the left chest. Okay, left chest. That's the point of entry. Point of entry was in front. Point of entry, anterior left chest. On the anterior left chest. That's just the point of entry. So that's where the gunshot was, and the point of exit was a... Oh no, there is no point of exit. No point of exit. Alright. I think that's good. Oh, and breath sounds. Decreased breath sounds. Left chest. Okay. Okay, what are you guys gonna do? So we got a 26-year-old Kamen Rider. He complained of a gunshot wound on this morning at 8 a.m. And then he came to the ER. His blood pressure is 70/50. Heart rate is 120. Respiratory 24. Temperature 37. Oxygen saturation is 98. And he has a gunshot wound on his left chest. The entry was on the left anterior chest, so that's the front. But here, there is no point of exit. Decreased breath sound on the left chest. What are you gonna do? What is the first thing you're gonna do? Okay. First thing you guys are gonna do. What is the first thing you will do? There we go. Let's look at the... Okay, I'm gonna look at the chat. Kamen Rider na baril dahil sa shoot review. Yeah. Oh wait, Vaxius, you're here. Hold on, Vaxius. I am going to make you mud. Okay, Vaxius, you now have wrench. Vaxius now has the wrench. Di sa Tondo. No, he got shot in Makati. I mean, Brett already got injured in Tondo. Dudut-dutin. What the heck? Dalawa lang yung laging pasyente. CT scan and do exploration... CT scan and do explanatory. Laparoscopy to trouble... Number 4, that's a good try. That's a good try, but you got the terms all wrong. You got the terms all wrong. I would put a... Wait. Okay, I'll put a poll. How do I put a poll here? I don't know how to put a poll. Ask that patient is real, and if so, just leave him be. Bro, why? Why would you do such a thing to Rian? Okay, I'm gonna ask a poll. Okay, what would you do first? What would you do first? I will make a poll. Okay, let's do a poll. What would you do first? What would you do first? Okay, a CT scan. Closed. CT scan, chest X-ray. Can you put another? Oh yeah, we can add another option. Okay. Chest. Okay. All right, there we go. I put a poll. I put a poll. Did the poll come out? Oh, there we go. There we go. There's the poll. I was wondering where the poll is. Okay, let's see. What did you guys answer? Okay, CT scan. Take off the suit now. Ano operahan mo may suot? Bruh. Okay, we got. Okay, people doing chest X. Okay, people are choosing chest X-ray. CT scan, put tube in chest. Okay. CT scan and thoracotomy. Yeah, remember, this is what will the first thing you're gonna do, okay? What is the first thing you're gonna do? Okay, a lot of you are... Okay, majority is chest X-ray. And then put tube in chest is tied with CT scan. Are you guys done answering? I think. Clean the gunshot. Okay. I think, okay, we got... I think this is all. I think this is all. No one's gonna answer anymore. Okay, it's... Alright, I'm gonna end the poll now, okay? We're gonna end the poll. End poll. So, majority of you said you will do CT scan first. Chest X-ray first, I mean. Okay? Alright, let's... Majority of you said you'll do a chest X-ray first. Okay. The answer to this question is actually put the tube in first before you do a chest X-ray. Why? Why do you put the tube in first? Because his vital signs are unstable. Oops. His vital signs are unstable. He's going to, like, if you don't address that... Oh, shoot. Oh no. What did I do? Let's change the color. He has a gunshot. He has a penetrating chest injury. So definitely there's an injury going on there. He has bleeding or air inside the lung or the chest that is not supposed to be there. And he has a blood pressure of 70/50. You have to address the problem first. So you do the chest tube. The chest tube only takes 10 to 15 minutes to do. After you do the chest tube, the insertion of the tube, that's when you do the chest X-ray. Okay. That's why vital signs are very important when in assessing trauma patients. You don't just look at this. You don't just look at how the wound looks like. You have to look at the vital signs also. That's why I always put that. Tama yung nakopyan. Okay. We'll do one more. One more and then we'll end stream, okay? We'll do another one. One more. One more exam. One more exam. Okay. Let's do one more, let's see. Who do we... What's a good, Ah! Okay. Wait, hold on. Let me think of a trauma situation. Alright, let's say we have a... Okay. We have a... I'm gonna use initials now. We have a patient named JK, who's a 23-year-old male. 23-year-old male. Okay. JK. 23-year-old male. Nature of incident. Nature. This is a different. It's not bread and real. I'm gonna give you guys time to think about who JK is. 23-year-old male. Nature of incident. Let's see. He got let's say mauling. Or no, instead of maul, it's just a different. He fell. Okay, fell. He fell around 12 noon. Fell around 12 noon today. 28:22. Was that place? Where did he fall? He fell. No. Place where he fell in a. San ba pwede? Fell in ano. Yan. He fell in Mount Mayon. JK Rowling. That's not. It's not J. Male nga eh. Okay, he fell in Mount Mayon. Okay. Alright. Let's see. Physical examination. His BP is let's say 120/80. His heart rate is 99. His respiratory rate is 23. And then temperature is around 36.7, something like that. Yeah, he fell down a mount. He fell in Mount Mayon. And then Otosat is let's say it's 100. Room air. Okay. And he has what did we find? He is GCS GCS 14. Okay. And then he has a soft tissue. Oh no. Let's say he has a 3 centimeter laceration on his wait, oh, let's make this longer. So 3 cm laceration on the right right frontal area. So that's in the forehead, okay? The right side of the forehead. And not just that. He has a 6 by 8 centimeter bluish discoloration in the left upper abdomen. Oh, there, you got 2 injuries now. Okay. Ano ba yan? Why you guys are trying? Jenny Cobredo. Pap Master Hoy. Ano yan? Ano yan? Okay, question number 1. Kailangan niya ba ng ano? Question number 1. What's this? What imaging will you request for? Okay. What imaging? So that's like CT scan, chest, CT scan, X-ray, etc. Number 2 is what? Bonus question na lang. Ito yung ano, this is the question na lang, okay? And then bonus question, sino si JK? Bonus question, sino si JK? For now, okay? Alright, let's do a poll. Poll. What imaging will you request? Okay. So, okay, wait. Let me scan. Alright. Okay, the choices here, there are two correct answers here, okay? There are 2 correct answers. You can just choose one, but then yes. Jungkook. There are 2 correct answers. Okay. I wanna see what you guys are gonna say. This is for the imaging, and okay, let me see what. Okay, we got CT scan, X-ray, MRI, fast. Fast and CT scan. Like, there's 2 correct answers, okay? So if you get at least 1 correct answer, that's okay. Yeah, no, I learned a lot from the stream, sadly I can't hang out. That's okay, I'm almost done. After this, where it will be done. And then sino si JK? Clue. I don't know why you guys have different names in mind, but actually, I don't know if which is his last name and which is his first name. I'm guessing the J is the first name. Let's start with the K. The K, the next letter after the clue is Ikemen. Ikemen VTuber. Okay. Ooh, 19 votes. Okay, we got more on CT scan and more on... The most is on fast. Okay. Okay. Dun, 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 dun. Okay, so we got most of you said fast and CT scan. Jessica Bredo. Bruh. Daming injuries sa VTuber. Okay, so most of you got CT scan and fast. Okay, yeah, the answer... Okay, the answer is... Oops, hold on. What happened here? Okay, my chat disappeared on my OBS. Anyway, my chat disappeared on my OBS. Anyway, yeah, the answer is CT scan, especially cranial CT scan. Okay, because he is a GCS 14. And the other one is fast, okay? The other one is fast. Although you can do CT scan of the cranium or cranial CT scan and CT scan of the abdomen. Okay? Because why imaging first? Why can you do imaging first? Because vital signs are okay. Except for this, but you know. And considering that it's 10 p.m. right now and it's 12 noon. The injury was at 12 noon. It's been how many hours since the injury? So he should be stable. You can just do, you know, imaging first. The next thing you're gonna do is suture the laceration. You just stitch that up. Okay? So, what's the answer to your, what is the answer? I'm gonna end the poll now, okay? What is your answer to the bonus question? Pag nakakuha na to, if you answer this question correctly, you get plus 10 points. Plus 10 points. Jake Clues Ikimen VTuber. I don't want another clue. I don't know. I have no idea what other clue I can put here. Janjiro Kamado. Someone almost got it. Cryptocurrency. What cryptocurrency? Jamyaku. Yeah, it's actually Kamyaju. Imaging before stitching. Can you patch it first? You can actually do the stitching first. But you know, if you're going to consider that he has a GCS of 14, and you know, if you find a bleed in there and there's a fracture in the skull, you might as well do that in the operating room, right? Instead of suturing it there and then having to open up the wound again. Okay. So you do the imaging first. Alright. Okay. Oh, there we go. My chat came back. Okay, I think that's all. I prefer Jamia Q. JK, Jamia Q. Okay, yeah, and that ends my medical education stream for the week. for today. We've been streaming for quite a long time. It's 10:41. That's long. Actually, I think this is one of my longer medical education streams. I usually stream for like an hour, 30 minutes for this. I think I went 2 hours. Yeah. Alright, so thank you everyone for watching my medical education stream. I hope you guys learned a lot. And for those who are new here, and those who you know, just recently subscribed, I don't usually stream here on YouTube. Actually, I only stream here once a month for medical education. The reason why is because when I stream it here on YouTube, it automatically saves the VOD, so I don't need to keep transferring. So if you want to watch more of me, I usually stream on Twitch. I actually stream on Twitch, so majority of my streams are there. You can just follow me on I would appreciate it if you guys follow me on Twitch also. Put the link. Twitch.tv/Yori. Oh. Okay. Oops. I would appreciate you guys follow me on Twitch also. I usually stream there. Okay. Let me yeah, there, spam my link. I usually on Twitch I usually play a variety of games. I stream a variety of games. I sometimes do chatting streams, karaoke streams, whatever. I'm a variety streamer, so I stream anything. I do medical education streams also on Twitch, but those are more free talk and not really a set topic, so it's more like whatever comes to mind, and if there are any questions, we start talking about that. Okay. And Fapmaster, there's no Tuli command here on YouTube. Okay. So yeah, please do follow me on Twitch also. Okay. Thank you everyone. I'll be going to bed. I'll be resting. I'll see you guys again on my next stream will be on Saturday. I don't have a stream tomorrow because I'll be on duty. My next stream will be on Saturday on Twitch. I'll be playing Dying Light 2 with Rion, the Kamen Rider VTuber. It's a collab we do every week until we finish the game. And then on Sunday, I also have another collab with 3 other VTubers. We'll be playing GTFO. Okay. Anong bird? What's the bird's name? My bird's name is Kumo. My bird's name is Kumo, as in like cloud, because she looks like a cloud. Okay. Otsupon! Will there be a medical education stream next month? Yes, every month there will be. I'll always announce it on my Twitter and my Facebook account. So you do 2 medical education streams, one on Twitch, which is a free talk medical education stream, and then the ones with a set topic are here on YouTube, which is once a month. Alright? Elden Light, let's go. Elden Light 2. Okay. I might watch it Twitch. My eyes seem to be throttling though. Oh no. Raid messages. There's no raid here on YouTube. But yes, I am more regularly streaming on YouTube. I mean on Twitch, not YouTube. And I do once a month on YouTube. Here I just upload whatever VODs. I might upload a collab VOD here. And my other VODs that I've been too lazy to upload, but I should upload them soon. Alright, Otsupon! Otsupon! Kumo does not fuck you, bread! Tangina mo, bread! Otsupon! See you guys! See you guys on Saturday on Twitch! Okay, bye-bye! Bye-bye!